Bismillah ar-Rahman ar-Rahim. I'm going to talk about von Willebrand disease. First of all, introduction about von Willebrand factor. Von Willebrand factor is blood glycoprotein involved in homeostasis. It's defective in von Willebrand disease. As we see in the picture, injury of blood vessels and exposed to subendothelial collagen. So, von Willebrand factor acts as a bridge between exposed collagen and platelets. Von Willebrand disease is bleeding disorder due to von Willebrand factor deficiency or dysfunction resulting in both abnormal platelet adhesion and low level of factor VIII, which lead to homeostasis defect. This disease is usually congenital, but it can be acquired. There are three types of von Willebrand disease. Type 1 is partial quantitative deficiency of von Willebrand factor and usually inherited as autosomal dominant. Type 2 is due to qualitative abnormality of von Willebrand factor and usually inherited as autosomal dominant. Type 3 is recessive inherited and patients have complete deficiency of von Willebrand factor. Their parents are often phenotypically normal. Sign and symptom of patient have von Willebrand disease: abnormal menstrual bleeding, bleeding of gums, bruising, nosebleeds, and skin rash. Laboratory diagnosis: first line laboratory test, ABTT, bleeding time and platelet count. Second line of laboratory diagnosis, specialized test, von Willebrand factor resistant cofactor activity, Willebrand factor antigen and binding to factor VIII, and collagen binding assay. Treatment of patient have von Willebrand disease depend on severity of condition. Use of desmopressin and plasma-derived factor VIII concentration contain von Willebrand factor and cryptoprecipitate. And finally, there are some disease must be differentiate between them and von Willebrand factor, so must be to know differential diagnosis. Hemophilia A, factor VIII is reduced, whereas von Willebrand factor resistant cofactor is normal. Pseudo von Willebrand disease, a platelet disease involving increasing affinity of glycoprotein 1b platelet for von Willebrand factor with variable level of thrombocytopenia, done by medical student in Al Qura University.